Our next speaker is uniquely qualified to talk about that. She is a haematology nurse specialist in Beaumont Hospital with 20 years experience working with people with cancer in haematology and oncology settings. Ladies and gentlemen, please give a warm welcome to Rachel Fox.
Well, we've had the Messiah and we've had John the Baptist. I know when I walk into a haematology day ward and I see everybody lined against the wall, I feel like Mary Magdalene if I don't get patients through the day ward very soon. I'm actually not sure. How's up and down? I can absolutely have Richard. Please. Okay, so I'm going to talk a little bit about the importance of a good relationship with your doctor, your healthcare professional and your nurses, and a little bit about how to prepare for your meeting with your healthcare professional, which is really important. So good communication is really important between you and your healthcare professional. It's about respect for each other, respect for everybody's time, and it's about establishing a rapport with your consultant, with your nurse, and with your other healthcare professionals. I think sometimes when patients come to the hospital, they have an expectation, and sometimes when they leave, that expectation is very unfulfilled. And I think it's very important to have a little bit of forward thinking about how you want your meeting to go with your doctor or with your nurse. Because I truly believe that the more informed you are as a patient about your disease, about your plan of care, and about where you're going forward, the more empowered you feel as a patient. Yeah, I am. Thank you. So I think we'd all agree that a better doctor-patient or a better nurse-patient communication leads to better healing for patients. A US study has shown that 48% of patients said that they are always involved in decisions about their treatment. 29% of patients said they didn't know who was in charge of their case while they're in hospital, who was actually in charge of their care, who was making decisions about their care. And I think 81% of doctors and nurses agree that communication makes a difference to patients. Just about the process of the consultation with the patient from the healthcare perspective, and indeed from my own perspective as a nurse. Before we even meet you and call you in from the waiting room, we're preparing about what we're going to say to you. Sometimes that can be good news, and sometimes that can be news maybe that you don't want to hear or have to hear. We have to gather the information that we're going to talk to you about. We have to understand, and we have to elicit understanding from you about where you're situated in your disease, what you want to hear, what you want to know, and communicate this effectively through the consultation process. And through this, then, we negotiate a plan of care with you. And hopefully then you go away happy. But often you might find that this doesn't happen for you. This is just a little outline of your healthcare team. Sometimes I think patients might be under the impression that it's just the doctors and the nurses in the day ward or in the hospital. There's so many more people behind the scenes associated with your care. There's the pharmacist involved in your medication management, checking your chemotherapy, making sure that any drugs that you're on don't interact with your current therapies. There's the diagnostic department, the lab scientists checking your blood. And there's also your nursing team, which you're very aware of. Your consultant I've put here in the middle because ultimately your consultant is in charge of your care. They prescribe your care, and your care then is carried out by all the other members of the multidisciplinary team. Specialists I've put up there because I think people are unaware of the other supports that you have in the hospital, such as dietitians, physiotherapists, occupational therapists, speech therapists, a very important part of our team is our social work. I think everybody with a diagnosis of cancer should see a social worker for a means assessment in terms of finance, in terms of support, be that for you or your family or your carers. And then there's the care managers in the background, and I call those your nurse managers, your middle managers, your higher managers in the hospital. And then there's the access to the service. How do you get to your appointments? What's available to you? Do you have a friend to drive you? That there's other supports in the community through Irish Cancer Society. I think there's still Drive to Care, Travel to Care. So there's always going to be somebody to get you to your appointment. You just have to communicate that need in the hospital. So, meeting with your healthcare professional. It's really, really handy for us if you have prepared in advance. If you have a list of your past medical history, it's really important. A list of the doctors that you've attended, your GP. I find as a nurse also to have your dentist to hand is really handy for me, because my job involves sometimes ensuring that the patient has had a recent dental check and maybe they need dental interventions, and I like to talk to the dentist about that too. A list of medications that you're on. And I think you might be or may not be aware that in your pharmacy, when you go into your pharmacy, they can do a printout of your medications. You don't have to keep a record. Every month you can go in, collect your medications and get a printout of what you're on. And your pharmacist will also, either in the hospital or in the community, are always happy to talk to you about what those medications are actually for. I think there's many people that are on medications and they do not know what they are for. And I think it's really good as a patient to know what they're for, and it's just all part of the empowerment process as a patient. List of any allergies you've had or have ever been suspicious of before, maybe as a child, and your family history is very important too. And also always bring your medical card or your health insurance as well. If you don't have a medical card, you should always see a social worker about in the hospital, or ask to see a social worker about that. I think really lots of patients don't realise that they are entitled to disability, long-term illness, medical cards, GP only cards. So there's lots of services that you are actually entitled to, and to discuss that with the social worker. So during the consultation, I think it's handy to keep a diary. If I have a chance to meet with patients, and I know a lot of CLL patients don't often get a chance to meet with the clinical nurse specialist, or even they might feel that they're bottom runged a bit because they may be very well, and they feel that they're more well than other patients, so they don't tend to take up as much time. And it's handy to keep a diary, keep your symptoms logged in your diary. Just, you don't need essays, just clear bullet points of symptoms, see where you're going, your side effects of your treatment, and things like that. And explain your concerns to your doctor and nurse very succinctly. You know, just rather than saying, I've had back pain, I'd like an MRI. You know, you can say, well, my sister had cancer, it spread to her bones. I'm really concerned that this might be happening to me. Is there anything, can we talk about this? And the other thing is learning at your own pace also is very important. Ask yourself before you go in, how much do I want to know? Make sure that before you go in, if you're bringing a support person in with you, that they're not going to ask questions that you don't want to know. So any questions that you have for the doctor or nurse beforehand, make sure they're your questions. They're not your support person's questions, and that you've discussed this with your support person before you go in, because it's not unusual to have a support person asking a very profound question that the patient themselves isn't asking and may not want to know the answer to. So I always say chunk and check. You come out of your consultation, or just take in the information, process it. You can write notes afterwards. Very important to ask your nurse or doctor for contact details to the day ward, 24-hour contact details, and weekend contacts. Useful and reliable websites are very important as well, and patient support services both in the hospital and in the community. So support is really important from diagnosis through treatment, and that means seeking it in the hospital but also seeking it at home, bringing somebody with you to your consultation that is reliable. It doesn't have to be your next of kin, somebody who's going to come maybe more than once, who is a good listener, who is not going to ask questions for you, but rather support you in asking the questions, because anxiety affects your ability to hear, and the minute you're called in for consultation, you're already having the palpitations, and those 100 questions that you wanted to ask the doctor has already left your head. And I think everybody has been a patient, including doctors and nurses, and that has happened so many times to people. And then they come out to the nurse and said, I wanted to ask this, or I forgot my prescription, or there was 10 questions I wanted to ask and now I've asked none of them. So ask your support person to take a couple of notes after the consultation, not during the consultation. I think, at times, even myself, I've been asked if somebody could record me, or it's very distracting if somebody is taking down notes while I'm trying to talk, or the doctor is trying to talk. So your support person is there to listen and to write a couple of bullet points for you afterwards. And you can always ask, if you don't have a support person, for a nurse to go in with you, and she can listen and then reiterate and break everything down for you as to what's been said. So you just have to ask. And just always ask as well your doctor or nurse what to do when you become unwell at home. And I wrote down act accordingly, because sometimes we give advice to patients. Maybe if you have a temperature, to attend A&E if it's at the weekends, and you'll get a call on Monday morning and somebody's had a temperature for 2 nights. So we really, really want you to take the advice that the doctor has given and the nurse has given. It's your information, so don't be afraid to ask questions. It's okay to ask questions. It's okay to ask and for clarification if you don't understand things. Anxiety, can blur your ability to understand what's going on at the time. And different medical language as well can blur your understanding. You can ask as many questions as many times as you want to. And I think it's handy to list your questions in advance. Not an essay format. You don't need a big book, just bullet points. And again, your support person can prompt you. They're there to prompt. You can ask for copies of letters, if you like, of referral. And you can ask for your blood reports, if you like, also. That's no problem. Just always ask for some education behind your blood reports. Sometimes people are collecting blood reports and they don't understand what the results actually mean, and slight variations up and down can be profound to a patient, and they can go home worrying about it when there's actually no need to worry at all. So if you're going to collect blood reports, just understand what the normal ranges are for them. So your appointment is a two-way discussion. If a procedure or treatment is to occur, when I'm talking to patients myself, I'm always one-on-one, or there's only a couple of people in the room, I always get them to use the what, why, how, when and where prompts to develop their own questions. What are the risks, what are the consequences, and are there other options for me? They're just very simple questions to get you thinking about what way you want your consultation to go. Sharing of information is really important, and I think we can agree a lot of the time that many of you might come out of the day ward or the inpatient hospital service. If you're ever an inpatient, they'll always send a discharge letter to your GP. But in many day wards, they don't send a GP letter every single time you attend the day ward. They have hundreds of people coming through every week. Some day wards do, but a lot of day wards don't send GP letters. And it's not unusual for me to get a call from a GP saying, I haven't had an update about your patient in a year or 6 months. I don't know what's going on. So it's really important to ask your GP. Sometimes it's okay to ask your GP to give the clinical nurse specialist a ring, or to give the day ward a ring, or to ask your consultant or registrar that you're having the consultation with, can you update my GP as to what's going on with my illness? And he'd like to know. That's fine, we'll do the letter. And I wrote oncologists there as well, because I know some of you are being treated by oncologists as well as haematologists. There's also your communicating with your public health nurses and other community specialists. Like, you might have home help who may be interested in your care and might want to communicate with the nurse specialist. You might have home physio, home OT. So there's lots going on in the community, and there's lots of people in your supportive network in the community that might be involved with you that we're not communicating with. So you just have to ask us and remind us to do it, and that's no problem. So being organised for your hospital visit is really important. And I always say this to patients, and I know I've said it, Robert O'Connor was at one of my talks before, about you are the best repository of your own information. The more you know about yourself, the better, and you will only know that by asking the questions to your doctor and nurse. So keep a small, accurate record. Each time you come away, pop it in a little folder at home, and then you know where you are, what treatment has changed, what tablets have changed, how are my symptoms changing, all of those kinds of things. Being prepared for your visit is really important. Please bring a snack. I always say to the patients, bring a snack and a bottle of water and a packet of tissues. You know, your nurses and doctors, they are very busy, and they're there to discuss your healthcare needs. It's sometimes really hard to feed you also. And sometimes I do see patients sitting in the day ward, and they're there for 4 hours, and they come up to me and say, I'm so hungry. And I go, well, so am I. But just bring a snack and some water as well. It's really important. Don't let anybody passing out. And I always say bring hand sanitizer as well. I know there's loads around the hospital, but bring your tissues and your hand sanitizer. Ways to ask your healthcare professionals to listen. I know sometimes when we bring you into the consultation room, we look like we're too busy. And we look like we're too busy to talk to you or even answer your questions, because we're rushing around and we're walking around, and we kind of give you that impression, I think, from the off. But, you know, there are ways around that. It's okay to say, I know you're very busy, but, you know, I've come here today. Is it all right if I ask you a couple of questions about what's going on with my healthcare? And I don't think there's anybody who's going to turn you down. We spoke about watch and wait today, and a second opinion sometimes is something that can crop up, I think, in haematology, and I think often in CLL. Patients become a little bit dissatisfied with this watch and wait. So I don't use that term watch and wait, I use the term watch and investigate, because I think that leaves a different flavour with people. It kind of tells them that we are looking after you still. We are investigating you still. We are following you up still. We're not boxing you and putting you to a side. But if you are unhappy about your care and you do want a second opinion, and it's something that does crop up now and again, and often at patient talks it crops up, and nurses are often the first person a patient will approach about this. It's okay to ask for a second opinion if you're not happy. Tell your doctor, tell the consultant, or if you can't do that, tell the nurse specialist or tell the nurse, and they'll convey it for you. But it's good to inform them, because they can help you in turning over your care to someone else. It's not a personal thing. And just so that you do know, oftentimes your chemotherapy treatment isn't decided by one person, it's decided by many. And consultants talk to each other, and they look at your whole picture, and they decide on the best treatment for you. And it's okay to ask, has my case been discussed at MDT? Has my case been discussed with other specialists? Be involved about the decisions in your care. It will empower you. Know about your disease. Know about your treatment. Know about your tablets. Don't say I take a pink one in the morning and a blue one in the evening. The more you know about yourself, the more control you have over your own disease and your own health care. Be honest and upfront about your symptoms, not just your physical ones. Your physical, your psychological, and your social care is really important in your healthcare journey. Everything is important. One part is as important as the other. Well in body, well in mind. We want to know all about it. And if we refer you for help, that is not a stigma. That is just part of your healthcare journey and your healthcare plan. Don't be afraid to ask for help and support. I remember when I started nursing in 1990, and years ago, we lived in a nurse's home. We trained with nursing nuns. They lived on the same corridor as us, so that we wouldn't be running out at night home. But we did, and they knew. And they said on our first day, when we were all lined up and regimented like soldiers, if there's anybody here that isn't in the business of caring, you have time to leave now. You're paid to care for patients, but we expect more from you than that. We expect you to give of yourself to people, or there's no place for you here. And that was a very special kind of nursing, because I started in intellectual disability nursing. I hadn't done general nursing first. And so I did see people drop out. A quarter of our class dropped out in the first 6 months. And I think you'll find that nurses and doctors are very approachable, even though they look busy. Don't be afraid to ask for help and support, because it is there for you. Ask us what's available to you in the community. All you have got to do is ask for 5 minutes and spend that time wisely.